Hello, students. Welcome to the 8th video lecture for Healthcare Ethics, Fall 2020. Before I get into the content of today's lecture, I'm going to talk a little bit about our course business. So, we are approaching the end of the semester. There are only 4 weeks left, including this week. So, by this point in the term, you guys should all have a sense of where you stand in the course. So you would be able to tell this based upon your grades on the worksheets, your grade on the midterm exam, and on the group project. If you have questions about your grade for this course, or if you're not sure where you stand, you need to email me so we can set up a time to talk about it. You should also know that the midterm exam and the group project weigh less in the total grade than the final exam and the second assignment for the course. So there is one more written assignment for this course and one more exam. The final exam is going to be another take-home exam, very similar to the one you just completed. It will take place on December 16th. So that's a little over a month, or just about a month and a half away. The final written assignment, which is separate from the final exam, is due on December 11th. It is an individual assignment, so not another group assignment, and you will be writing an op-ed piece on a specific topic in healthcare ethics. So an op-ed is a form of journalism in which you, the writer, express your opinions about an issue of great importance to contemporary society. And for this class, it's an issue in healthcare. And you're going to be asked to support your opinion with citations and well-reasoned argument. So I will post an assignment sheet for this op-ed next week, and we're going to do some work that leads up to it in the worksheets in the coming weeks. But I wanted to give you guys a heads up this week so you know where we're headed in the course. All right, so today I'm going to be talking about an issue of healthcare ethics that is quite applicable to a situation that we were all living in right now during the coronavirus pandemic. So this is a lecture on the ethics of quarantine. It covers 2 texts which you guys are reading for this week. The first is an article titled Public Health and Ethical Considerations in Planning for Quarantine, and it was written by Martin Cetron and Julius Landwirth and published in 2005 in the Yale Journal of Biology and Medicine. The second text you guys are reading is an excerpt from a philosophical book titled Discipline and Punish: The Birth of the Prison, which was written by Michel Foucault. It was originally published in 1975 in French, and it was translated into English by a guy named Sheridan and published in 1995. So Foucault is a major philosopher in the Western canon, and he's a little bit different from the other figures that we've encountered so far in this course. And I'll talk a little bit about that in the lecture when I get to his text. But we are reading the opening pages of a chapter from a larger book that he wrote, and the chapter is on Panopticism. Okay? So, first, Cetron and Landwirth. Public Health and Ethical Considerations in Planning for Quarantine. So I want you guys to note that there is a really good set of definitions at the beginning of this article. I'm not going to go over them here, but it would be very clever of you to take note of them because they might appear on the final exam. Okay? So make sure you read them carefully. Instead of defining quarantine, What we're going to examine in this lecture is the ethics of quarantine as discussed by these authors. So Cetron and Landwirth wrote this article well before our current pandemic began. They wrote it in order to encourage public health authorities to develop plans for just such a pandemic. Note the planning in their title, right? So whether or not they were heeded is kind of up for grabs. But the important point for us is that they are worried in the article that if adequate plans for a pandemic are not developed in advance, then ethics will just get thrown out the window when the pandemic arrives, right? So they say on page 328 that individual fear and community panic associated with infectious disease often leads to rapid, emotionally driven decision-making about public health policies needed to protect the community that may be in conflict with current bioethical principles regarding the care of individual patients. So part of what we're going to suss out in this lecture is the terms of that conflict. So the ethical principles that we have studied thus far in this course, autonomy, non-maleficence, beneficence, and justice, are primarily about the individual patient. Justice, perhaps not. Justice comes closest to addressing this question of the public and public health. And last week, we saw a situation in which the concept of individual patient autonomy came into conflict with the ethical responsibilities that healthcare providers have to each other in terms of preventing the harms caused by racism, and the ethical responsibilities that healthcare providers have to the broader ethical concept of social justice. Okay, so besides those two exceptions, autonomy, non-maleficence, beneficence, and justice, as we have studied them, are all about the individual patient and the patient-provider relationship. Yet here, in terms of talking about quarantine, we're going to address a question of a larger public. So, Cetron and Landwirth write on page 327 about the discipline of public health. So although the discipline of public health has its origin several centuries ago, it is only relatively recently that ethical principles and codes to guide public health practice and policy have been formulated. So public health ethics, while public health is really old, public health ethics is kind of new, is what they're saying. The ethical principles at the heart of more fully developed fields of medical and research ethics are grounded in the primacy of individual autonomy in clinical decision-making in therapeutic settings. So that's basically most of what we've been talking about in terms of autonomous decision-making and the responsibilities of the provider to the individual patient. So ethical principles are grounded in the individual autonomy in clinical decision-making in the therapeutic setting and in consent for participation in the setting of human subject research. So we're not going to talk about research ethics very much in this class, but what's important for them, for Cetron and Landwirth, is that they both rely on the idea of individual autonomy. It's the core ethical principle that motivates all the others. They are guided by a fundamental moral axiom that individual persons are valued as ends in themselves and should never be used merely as a means to another's ends. Public health, on the other hand, emphasizes collective action for the good of the community. So, according to Cetron and Landwirth, quarantine sets up an ethical conflict between autonomy, the autonomy of individual persons, and community, the good of the community. So, we'll draw that out a bit more clearly as we go. So we have this conflict between autonomy and community. And on page 328, there's a block quote that Cetron and Landwirth are taking from the Public Health Leadership Society. And the Public Health Leadership Society says, regarding this very conflict, there is no ethical principle that can provide a solution to this perennial tension in public health. That is, the tension between individual actors and the larger community, the public. So they are admitting to an unresolvable conflict here. There is no ethical principle. So this is something that opens us up to the kind of philosophical speculation that Foucault proposes, that we'll address in a little bit. But I want you guys to put your critical reading hats on for a minute and observe the form of this essay here. So this article has a lot of block quotes in it. We've seen some of this before in other essays that we've read, but it's useful to go over the purpose of a block quote. So when you include a long quote in an essay, you're supposed to set it apart from the rest of the essay to indicate that it's someone else's words. So block quotes are just like quotation marks, but they're used in formal academic writing for long quotations. And they are a useful visual marker of how academic writers construct their arguments by drawing on the work of one another. So you can actually see on the page when someone else's writing is showing up, right? That's what the block quotes do. So every time you see those block quotes, check the surrounding sentences or the footnotes to see who is doing that writing, who Cetron and Landwirth are calling on to back up their argument, right? You're going to have to do a bit of backing up your argument when you write your op-ed, though I strongly discourage you from using block quotes because you're not writing something that's the same sort of academic prose that Cetron and Landwirth are writing. Okay, that said, you guys also might note at the end of the block quote from the Public Health Leadership Society on page 328, which I was just referencing, they talk about the police powers of public health. So the police powers of public health are something that will come much clearer when we get to Foucault. Okay, so and then back to the beginning of that quote, there is a claim that there is a perennial tension in public health between autonomy, between the autonomous individual and the good of the community. So how do we resolve this conflict? Another way of asking this question is, what would an ethical quarantine look like? What makes quarantine ethical? So Cetron and Landwirth cite 4 principles from a guy named Rosh Upshur in another block quote on the other side of the page to try and come up with an answer to this question. What might be a bioethical quarantine? What might be an ethical justification for putting a quarantine in place? So the 4 principles that they talk about are harm, restriction, reciprocity, and communication. So in terms of harm, there must be clear scientific evidence to justify a quarantine. So if you're going to put people into quarantine, you need to have the science to back it up. So there is no point in instituting quarantine for cancer, because even though cancer is a very, very terrible disease that causes a lot of harm, it's not communicable, right? But there's also no point in instituting quarantine for the flu. So a quarantine could definitely stop the transmission of the flu, the ordinary, flu that you get in the winter, right? It's a easily communicable disease, one that could be stopped by quarantine. But the harm that is caused by the flu isn't that great. It doesn't warrant something as restrictive as quarantine. So, according to the ethical principle of harm here, the potential harm caused by the disease must be greater than the harm caused by the quarantine. Okay? So it needs to be worth it if you're going to institute a quarantine. The next principle they talk about is restriction. So they are interested in, much like our contemporary government, interested in instituting the least restrictive form of quarantine possible in order to be effective. So they want to use the least restrictive means. By that, from an ethical perspective, they're interested in the idea that quarantine measures should try to respect individual autonomy as much as possible. So public health authorities should institute the least restrictive form of quarantine that is still effective. So this is how we end up with something like social distancing instead of true quarantine in the United States, right? Because there is a great desire to protect individual autonomy in our society. Okay, whether or not it's effective, that's another question. Reciprocity, the third principle that they talk about, is kind of the biggest one. So this is a good point to pay attention. So the community has an obligation, according to Cetron and Landwirth, through this guy Rosh Upshur, the community has an obligation to provide necessary support services for those in quarantine. So you can't just lock people up in their houses and not feed them to prevent the spread of disease. This would be effective, but highly unethical. So in the 17th century documents that Foucault quotes, the town delivered bread and wine, fish and herbs, etc., to people who were living under quarantine in order to perform some form of reciprocity. A more contemporary version of this looks like stimulus checks and PPE loans or supplemental unemployment benefits. So the principle of reciprocity states that there is an ethical obligation for the society to care for those who are affected by quarantine measures in order to compensate for the loss of individual autonomy. So society is getting something out of the quarantine. That's the larger public and public health is getting something out of the quarantine. It's getting health. And therefore, it needs to compensate the individuals who are accepting restrictions on their autonomy in order to make it happen. Okay, so that's reciprocity. Communication is the last of the principles that they outline. And that one seems pretty straightforward, right? The idea is that public health authorities must communicate reasons for their actions to the public and allow space for public appeal. And that's because quarantine involves everybody, the whole public, in an attempt to control the spread of a virus. So you cannot have an ethical or effective system of quarantine unless everyone knows what's going on. Reciprocity seems to be the most important principle here from an ethical perspective. This is the aspect of our current soft, loose, not even quarantine anymore that government officials are struggling the most with. there's a lot of struggles in terms of how we would establish reciprocity to people who have been harmed by the pandemic. And it's also, this concept of reciprocity is one that addresses the heart of the ethical dilemma of public health. So if in a situation of quarantine, if I give up my autonomy for the good of the community, in return, under the doctrine of public health, the community protects and sustains me. So this is actually a form of a basic social contract, right? I give up my autonomy for the good of the community, and in return, the community protects and sustains me. So without reciprocity, any form of quarantine has the potential to be truly unethical. We will get 2 more versions of what ethical quarantine might look like on the next page of Cetron and Landwirth's article, but they're pretty similar. The additional point they make that's worth noting is privacy. So there's an idea that we should protect against the stigmatization of infected persons. This is something that's less true for our current pandemic and more true for something like AIDS, right? Which had a lot of stigma associated with it, but came with a different set of strategies for controlling the spread of disease. So the basic conflict here still remains that of the individual versus the community, or autonomy versus policy. So I'll give you a tiny snippet of derivation here. Autonomy comes from Greek, and it comes from 2 Greek words, auto and nomos, right? We've done this before, but I'm going to do it again. Autonomy, self, nomos, rule. Policy, on the other hand, comes from the Greek word for city, which is polis. The polis, the city, was the basic unit of political organization in ancient Greece. So there weren't really nations or states, there were just cities. And the city was the source of the government. Okay? So auto versus polis, autonomy versus policy, has at its roots the self versus the city. Okay, so the article ends on the virtue of planning. On page 329, Cetron and Landwirth write, careful attention to the ethical values at stake in public health decision-making can help foster voluntary cooperation and public trust, and should be a part of state and federal preparedness planning. So, this article was written in 2005, 15 years ago. As you read it, think, how well have we done in terms of establishing a plan that would protect these ethical principles come a situation like the one we are living in now? So did we plan for this? That's a question you guys have to answer for yourselves. And now, instead, we're going to shift to Foucault. So Cetron and Landwirth write at the beginning of their article about the historical origins of quarantine. They talk about bubonic plague, about ships in Venice, about the 40-day time that they had to wait in the port, which is the origins of the quar at the beginning of quarantine. And they do this to draw our attention to quarantine as an ethical dilemma. So Cetron and Landwirth write on 325, the historical association with exile and death, and the morally negative connotation of sacrifice of a few for the benefit of others remains an undercurrent of public apprehension about quarantine. So Foucault also is very deeply interested in this history, right? And he looks at the history of quarantine in order to reveal the general workings of political power. So now I'm going to ask you guys to put your critical reading hats on again and ask yourselves, how did this reading look different from Cetron and Landwirth? what's different about Foucault's text? So ethics, which we have been studying in this class, is a branch of philosophy. This class is in the Department of History, Philosophy, and Anthropology. This comes from the philosophy part, right? Foucault is a major philosopher of the 20th century. But why does his book look so different from Cetron and Landwirth's article? So in order to explain the difference, I'm going to give you guys a tiny pocket history of philosophy, okay? So healthcare ethics comes out of a tradition called analytical philosophy. You guys don't need to know this, but it's useful to know a bit of the history of what we're reading. So healthcare ethics comes out of analytical philosophy. Foucault comes from a different tradition, which is called Continental Philosophy. How are these traditions different? So analytical philosophy, which is primarily practiced in England and the United States, is interested in abstract propositions, in formal logic, and it is very closely related to math and science. Okay? So abstract philosophy analytical philosophy sets up very abstract scenarios in which to test ethical principles of the sort that we have been learning in this class. Continental philosophy, on the other hand, comes out of Europe, primarily Germany and France, and it's much more interested in language. So how language structures our lived experience of the world and all of the things that are in it. So continental philosophy is much more closely related to literature and history. So Foucault is a continental philosopher, and Cetron and Landwirth are bioethicists, which means, by extension, that they are analytical philosophers. So while Foucault and other continental philosophers have actually had a lot to say about biomedical concerns, Foucault has this really cool idea of biopolitics that people like to talk about. Continental philosophy is typically not taught in healthcare ethics courses because the discipline of healthcare ethics historically comes out of the tradition of analytic philosophy. So that means that you guys are super cool because you're getting to read stuff that comes out of the continental tradition, which is just like way cooler. Okay, so now that we've got that down, for our purposes, how does Foucault think about quarantine differently than Cetron and Landwirth? What is Foucault's argument? So he starts out with a long narrative description of a specific set of plague orders from the end of the 17th century. So it's full of all these details about quarantine. So not sort of abstract ethical concerns about how can we make an ethical system of quarantine, but specifics. How is the food provided? Who collects the bodies of the dead? Who enforces the quarantine? How do they know who is sick? All of the material apparatus of quarantine measures. He offers us a vision of a perfectly functioning bureaucracy. Officials who control and record everything. So not only do they write down the deaths and the rates of infection, but they keep track of the supply of bread and wine, the sanitation procedures, the access to medical care, the spiritual guidance, so like who has access to a priest, etc., etc. So this is the vision of the perfect bureaucracy occurring in the time of plague. So it's worth noting that what we're reading about, this vision of a perfectly functioning bureaucracy, is not really how the plague went down, right? But what he's referencing is a real historical document. So it's a document about what government officials wanted to occur. So Foucault is talking about a 17th century version of those pandemic preparedness plans that Cetron and Landwirth were on about, right? So there is a disjuncture between plans and reality in our present context too, right? And that same disjuncture is operating in the past. But what Foucault is interested in is the plan. So what does this plan for dealing with the pandemic in the 17th century reveal about the political order of society that we have inherited from the 17th century to the present? Okay, so also, guys, note that Foucault spends the first 2.5 pages of the reading talking about this historical situation. And then he moves on to his own commentary about it. So there's a shift there that you guys have to notice, because he moves kind of from the past to the present, or at least from referencing something else that isn't really his idea, but it's text that he's analyzing, to proposing his own ideas about it, right? So keeping track of what's Foucault and what's the plague orders is sometimes a little bit difficult. In his larger argument, he uses this historical example and a bunch of others to think about how social and political power function in Western culture. So Foucault says that the plague is met by order. This is on page 197 of your text. So if you don't have your text open, now is a good time to open it. And he says, this enclosed segmented space, observed at every point, in which the individuals are inserted in a fixed place, in which the slightest movements are supervised, in which all events are recorded, in which an uninterrupted work of writing links the center and the periphery, in which power is exercised without division, according to a continuous hierarchical figure, in which each individual is constantly located, examined, and distributed among the living beings, the sick and the dead. All of this stuff, all of these systems constitutes a compact model of the disciplinary mechanism. The plague is met by order. So he sees in this system for understanding and controlling the plague a compact model, a little version of this bigger thing that he sees at work in the history of Western culture called the disciplinary mechanism. Okay, so the order here is civic order. It is discipline and authority. So the chaos of contagion is met by the order of the polis, the order of the city. So contagion is countered by the political dream of a perfectly governed city. I think there's a little bit of that wish now going on in our political environment as well, right? So the plague is met by order. Its function, this is continuing on page 197, its function is to sort out every possible confusion. That of disease, which is transmitted when bodies are mixed together, that of evil, which is increased when fear and death overcome prohibitions. So the function of order, all of this order that the city is trying to institute, is to sort out people, to prevent the transmission of disease, and at the same time to sort out their ideas, right? So this belongs to a history of the idea of contagion as a transmission of ideas. This is actually the first use of the word contagion refers to contagious ideas rather than contagious disease, right? And the idea of fear and death overcoming prohibitions comes out of a literary tradition of encountering the plague, in which basically people just party in the face of death. So the idea there is that if something is so terrible that you know you are extraordinarily likely to die, like it's the end of the world, why would you bother to adhere to all of these restrictive rules? So that's the evil that Foucault is talking about, that the civic order fears. So I think we see a bit of this in our current moment too, in people thinking that they don't need to wear masks in public. But for us, this is complicated by the question of fear. So it's not that fear and death overcome prohibitions, but that people imagine that they are immortal and immune to death until they learn otherwise. So there is less hedonistic celebration in the face of death and much, much more denial. So there are many Americans who are refusing to reckon with the reality of COVID-19 in a way that would have been thoroughly impossible for someone living in the 17th century experiencing the plague. And that's simply because the number of people who died from the plague was just so enormous, and the likelihood that you would catch the plague and die was extraordinarily high, right? So our ability to respond to COVID-19 in a way that wasn't possible 300 years ago is due to the development of systems of order. Things like public health and hospitals that we use in order to manage the spread of a transmissible disease, like COVID-19. Okay, also sanitation, but that is a slightly different schema. So Foucault writes on page 198, continuing with our analysis, "The plague-stricken town traversed throughout with hierarchy, surveillance, observation, writing, the town immobilized by the functioning of an extensive power that bears in a distinct way over all individual bodies. This is the utopia of a perfectly governed city." So how does Foucault rearticulate the conflict between autonomy and policy? For Cetron and Landwirth, this conflict appears as a horizontal figure. So you have the individual and the community, and they're roughly on the same level, right? But there's just more of the community, and there's just one of the individual, right? And the conflict is between the many and the one. For Foucault, it's a different kind of figure. It's a hierarchical figure of the individual versus authority, right? So unlike the individual being on the same level as the community, for Cetron and Landwirth, for Foucault, this is a question of power relations. So how does the individual relate to the authority that establishes the system of quarantine? And we might think here about how the autonomy of the individual persists within the system of quarantine. This, after all, is Cetron and Landwirth's question and what they set out to use as a metric of an ethical system of quarantine. Thinking back to our discussions of patient autonomy from earlier in the term, we can see the situation of quarantine as another scenario in which autonomy might get challenged or redefined. So Foucault imagines that the city under plague orders will show us a dream of civic order from the position of the rulers rather than the ruled. So it is a dangerous, poisonous dream of complete control. Foucault's not down with it, right? Foucault is describing it, but he thinks it's dangerous. Yet, in the dream that Foucault is describing, there are things that escape the system of order, even in the text that he quotes. So this I want you to keep your eye on for answering the question on the worksheet. These things that escape the order of Foucault's fantasy. In the text, there are people called crows. So this shows up on 195. The crows are people of little substance who carry the sick, bury the dead, clean, and do many vile and abject offices. So we might think of these crows as being like the essential service workers or the first responders in our contemporary society. So these are the people who do the labor that keeps the city running. We also might think, in terms of who escapes this system of order, about the people who put it into place, the people who control it. So all the syndics and intendants, the police powers of public health, according from Cetron and Landwirth, right? So the people who are responsible for the surveillance and enforcement of the quarantine. So I'm asking you guys to do some serious critical thinking here and to write about it in your worksheet. So how is the system that Foucault describes constituted by that which escapes it? What are the necessary movements within the fixed immobility of the quarantined town? Think about our present here too. How does this fantasy of civic order compare to the lived disorder of social distancing? So, in conclusion, there is a conflict between autonomy and public policy, between the individual and community, that appears in Cetron and Landwirth as an unresolvable ethical dilemma. This dilemma is resolved in Foucault by the disciplinary mechanisms of political power. So the enforcement measures of quarantine tell us that individual autonomy is always in conflict with political authority, not just in situations of quarantine. And it might lead us to question authority, but also to question autonomy itself as an ethical principle. So the extraordinary circumstances of social distancing offer us an occasion to think about the ordinary workings of our social order and allow us to see more clearly the conflict between autonomy and authority, or between the individual and the community, as a constitutive concern of our lived reality, of the world as we know it. Okay, so some big picture questions here. That's it for this week, guys. So make sure you do the readings and have a look at the worksheet. And if you have any questions or concerns, please send me an email and I'll look forward to discussing it with you on Thursday. Okay, take care.